Hello, my name is Lauren Wirtz, and my research paper is about the rate of readmission in the geriatric unit of patients over the age of 60 between dementia and non-dementia. My placement was at Mercy Health Hospital, the Claremont location, and I worked in the senior behavioral health unit. I began taking this data in September and all the way up until February. In this area, it's in a rural part of Cincinnati, and we do get a lot of transports from all over Cincinnati because we are the only ones that do have a senior behavioral health unit, and the maximum number of occupants that we can have at one time is 16. The main issue is the rate of readmission within the United States. We are seeing a lot of patients come back within 30 days or even 60 days, and the reasons why they could come back could be medical issues or medication concerns, etc. Within my topic, there is always a chance of a patient coming back. It could be due to medical issues, medication concerns, or anything like that. But when we do see a patient come back due to behavioral issues, we do get kind of concerned on what we could have done better. When we look at them coming back, we look at their support system and how it could be different. So we'll do everything that we did the same time, first round, and we will see what their support system looks like, living conditions, things like that. My question is, though, what is the rate of readmission between the dementia and non-dementia? So this could either be like schizo, depression, anxiety, suicidal ideations, things like that. In my research design, I'll be collecting data that patients that enter into the unit after they were in the emergency department. And from there, I'll look at what we did differently the last time and what we could do differently this time around. In this sample, I'll be collecting data from patients over the age of 60 with different types of mental health issues. There will be 16 patients in this study who have been readmitted to our psychiatric unit during my time at Mercy. Over the past several months, patients in my study are 60 to 95 years old. The first chart is to show common age of patients being readmitted. As you can see, the common age of 60 to 69, and the less common age was 90 to 99 years old. The highest age that we did have was 95, and his diagnosis was dementia. We could see that it was common for people ages between 60 to 69 because they were just likely getting started experiencing behavioral issues and were not established onto their medication, whereas older patients have been on the medications for the same diagnosis for quite some time. Another big side that we do look at is the support system. Beforehand, I thought that if a patient was readmitted numerous times, that they didn't have a strong support system. What we actually saw is that unless they were unable to make decisions for themselves, it doesn't really matter what support system they had. I say this because all patients that were readmitted had family members and partners as their support system, and even some would have POAs. But since they are cognitively aware of what's happening, they are able to make their own decisions. We had 11 out of the 16 patients discharged home because that's what they were wanting to do. One patient that was diagnosed with dementia discharged home a previous time. That patient's family was convinced that they could take care of them, but they didn't follow through. All of the patients that were discharged home most recently have always been discharged home in their prior admissions. So when it comes to a patient being discharged home, we set them up with a primary care doctor appointment and either a psychiatry and mental health appointment. And if they don't have either one of those, then we will set them up with a new appointment. As a result, my hypothesis was not correct. I have found that there was many more admitted for other mental health diagnoses rather than dementia, until there was only 3 patients that were readmitted with dementia. With that, they were all placed in facilities. Other common diagnoses that were readmitted was depression, suicidal ideation, psychosis, and bipolar.